Hi everyone, I'm Jenny Rogers. I'm a doctor of physical therapy. I do pelvic floor physical therapy at Sullivan's. Physical therapy, tons of physical therapy. I will be presenting over returning to exercise and running postpartum. Okay, so one of my passions is helping pregnant and postpartum people stay active as possible through all of the emotional, mental, and physical transitions that occur with pregnancy. Now, exercise is one of the top stress relievers. It improves brain function, sleep, mood, body image, anxiety, and depression. And it's a way to maintain overall health and decrease the likelihood of chronic illness. So it is pretty vital that we're able to help people to be able to participate in any physical activity that they possibly would want through the big changes that are happening this season. Because if we're not able to practice all of our stress relievers, then it can be pretty difficult to get through. So let's talk about what happens once you're postpartum. You have the big 6-week postpartum appointment. For many people, this is a very confusing time. Some feel excited to meet their deadline and be cleared to return to sexual activity and exercise. Others may feel scared or intimidated, not ready, and unsure where to start. So we actually sent out a survey to all of our patients at Sullivan's and try to get a better idea of how people are really feeling about this 6-week appointment. 90% of our responses said that they were either scared to start exercise, did not feel ready to start exercise, or did not know where to start with exercise at all. This shows that there is a significant gap in how we encourage and educate postpartum individuals in their recovery process to get back to exercise. And there is a huge push right now from the pelvic floor physical therapy community that all individuals should come into physical therapy at least once to be assessed and educated on wellness for their core and their pelvic floor. This includes individuals with non-complicated birth, but even more so if there was some type of complications, vaginal tearing, a C-section delivery. Our bodies grow and change for 9 months to grow a little human. The least we can do is to supply people with education to start rehabbing their muscles so that they're able to properly take care of this little human and do so joyfully. Right? If we're in pain all the time, we definitely can't help that baby. There are a couple of factors to consider at the 6-week postpartum appointment or at 6 weeks postpartum. 1 in 3 women will have a C-section delivery. Ultrasound investigations have shown us that uterine scar tissue thickness is still increased at 6 weeks postpartum. This is suggesting that the scar is still remodeling, which means we're not ready to do all of those high impact activities at 6 weeks, because at that point, we only have 50% of its original strength at 6 weeks. And then at 6 to 7 months, we're then between 70 and 90%. So it can be a much longer recovery than anyone wants it to be. And then with the vaginal delivery, although the tissue will never return to 100% of what it was pre-pregnancy, it can still take up to 12 months for the main muscle that makes up that pelvic floor girdle to return to its size that it was pre-pregnancy, which means we just need to give our bodies a little bit more grace and a little bit more time for that healing process. This also does not include if an individual is breastfeeding. So there's also research that shows we will continue to have the loosey-goosey hormones in our body for several months after we're done breastfeeding, which is another indicator to us that we need to properly strengthen, but also give our bodies that grace it needs for the healing process. Now, when it comes to returning to running or any type of higher impact activity like jumping, research suggests that people should not return to running until at least 12 weeks postpartum, as well as be able to complete a whole list of exercises that allows the individual has to perform correctly And that informs us that they have proper strength, coordination, stability, and balance required to perform these high activities safely. Now, this is going to sound a little silly, but the way that I think about it in my head is that when someone has an ACL surgery, so ACL surgery for your knee, it requires a minimum of 3 months for that graft to heal enough to withstand the force that our bodies are pounding when we're running. So at first that sounds crazy to kind of compare it to delivering a baby, but every step you take during running is associated with a sudden rise in your abdominal pressure. It has also been reported that ground reaction forces of between 1.6 and 2.5 times your body weight can occur when you're running. And so all that force that is going through the leg, through the knee, can potentially also be going through the pelvic floor and the core. So it's all very, very related. It also helps reason why weak, less coordinated muscles in postpartum women may not achieve the level of function needed to maintain these roles, and highlights the importance and indication for adequate rehabilitation. Okay. So as much as we want to have the magic to speed up this healing process, we just don't. We have to start from square one. Now, have some people return to running prior to the 12 weeks? Yes, there's some, but they were most likely able to do so due to maintaining higher activity levels throughout pregnancy, and their bodies were able to compensate in other areas. So this could mean that they had some type of dysfunction that came up later on, whether that's low back pain, prolapse, urinary leakage, a sequence of things that we don't want to have to experience. Others will return to running too soon, and it results in all of those things, right? You'll feel it pretty immediately, either the prolapse, the knee pain, ankle pain, low back, urinary leakage, all the things. So at that 6-week appointment, what we really want people to know is that that's too long to wait to start exercise, but it is way too soon to start running. So this can leave us at a confusing spot. Where do we start? And so that's where I kind of want to break down to you today, is where you actually start with exercise postpartum. And we're going to start all the way at week 1. I'm not going to go through every single exercise that I would want someone to do from week 1 to week 2 to 3 to 4, all the way to that 12 week. But I'm going to give you a pretty good general idea of the different things that we want people to be working on. Okay, so at week 1 through 3, the main things we want to be focusing on is breathing, reconnecting your core, gentle activation of your glutes, gentle stretching, give those muscles some tender loving care, listening to your body and being aware of your posture and proper body mechanics for all of your childcare duties, activities of daily living, whether that's picking them up, showering, putting up the dishes, all the things that we just don't get to get out of just because we had a baby. And then around 2 weeks is when we want to start doing just gentle walking around the house. Okay, so at 1 week, we're trying to be in and around the bed as much as possible. 2 weeks, you can walk around your house a little bit. 3 weeks, you can start doing about 5 to 10 minute walks at a time. Okay, just gently starting to increase activity. Okay, at this point, it's pretty normal to still have aches and pains. Your uterus is still shrinking. You may still have some light bleeding in the vaginal area. If you have light bleeding that persists past 8 weeks, that's an indicator to you to go to your professional, your healthcare provider, because you may be just overexerting yourself. But early on, it's pretty normal. All right, at 4 to 6 weeks postpartum, what we're going to be working on is low intensity strengthening. So strengthening your core, your lower body, working laying flat, moving to sitting up. We're going to be incorporating your breathing into your exercise, so your pelvic floor and your breath is working for you rather than against you. We're going to continue to be mindful of those body mechanics, especially as we're picking up the our baby carrier, putting the stroller in the car, all of those things. And we're going to bump up to starting to walk 15 to 30 minutes. So as we build up, adding about 5 to 10 minutes on your time on your walk every week. So just slowly moving up. This is going to help improve the endurance of your pelvic floor muscles without getting that high impact. All right. So this is pivotal in making sure that their endurance is improving. They're getting oxygen, all the good stuff. All right. At 7 to 10 weeks postpartum, this is when we're going to start working on your upright strengthening. So moving into the standing position, having your full body weight through your legs. We are also going to start doing some higher level core and higher level glute strengthening. So really starting to feel the burn through there, getting a medium to hard level with the exercises. We also want to work on your single leg stability and balance. So running is basically doing several single leg squats, mini squats, lunges over and over and over again. And to be able to do that, you need to be able to have a proper balance and stability to hold you upright. And so you're not fluttering left and right. And with the way that our body mechanics change during pregnancy, a lot of times our legs move out wider to help balance us as our belly gets bigger. And a lot of times we stay with our legs wide apart to balance us. So we got to start moving that closer, making sure we have all of the muscles working accordingly to keep us upright. All right, and then we're going to start introducing a little bit of impact. So starting to train your pelvic floor muscles to be able to support you whenever we have a little bit of a bounce or higher velocity coming down. And then we're going to continue to bump up that walking time, right? We want to go to 30 to 45 minutes, start adding in some hills as well. Going up and down helps with strengthening that core, quads, glutes, all of the good stuff, as well as starting to get your heart rate up a little bit more. Because if our core and our glutes are strong enough, but our cardiovascular system can't handle it, running is not going to be ideal. Okay. Then we finally get to our 11 to 12 weeks postpartum. This is when we're going to start adding more resistance. So we might start adding in dumbbells, maybe a light kettlebell here and there. We're going to be working on dynamic stability. So we're going to be trying to reach out in different parts of us in different planes when we're standing on one leg. So not just standing still, but we want to try to reach out some and our legs still be able to support us, because when we're running, there's different obstacles that appear, right? We can go up and down a curb. Maybe the road is a little bit crowned. So we don't get just straight forward. All right. And then we're going to start doing some jumping. All right. Starting a jump progression and introducing jogging. Right? We can't just go back to running 1 mile, 3 miles at a time. We'll start introducing it by 1 minute at a time, 2 minutes at a time. And then we're going to continue those long walks on the days that we're not adding in adding in jogging. So doing 45 to 60 minute walks at a time. All right, so just gave you kind of the breakdown of what all we focus on with the different weeks, and it is a gentle, steady progression. Now the things that I want to go over is the things that you can begin to teach people at 1 week postpartum or that day of delivery. So the important things is diaphragm breathing and TA activation. So I actually have my coworker here with me to help us learn diaphragm breathing and TA activation. Yeah. Okay, so we're going to do this just as if we're in a PT session and how I would teach a patient how to diaphragm breathe and how to activate your deep core. Okay? So, have you ever learned diaphragm breathing before?
Yes.
Okay. Have you ever learned it from a pelvic floor standpoint? All right, perfect. You teach people all the time. So, here at the bottom of your ribs, you have your diaphragm, all right? And then right here, you have your pelvic floor. They're buddies. They like to hang out. They should hang out. They should move down together. They also should move up together. When this abdominal pressurized system is thrown off and they're not moving accordingly, we get all the things we don't want. We get a lot of pressure towards our pelvic floor. It can contribute to urinary leakage, pelvic floor tension, mismanagement of pressure, low back pain, all the bad stuff we don't want. And it's very common for that pressure to be mismanaged because when we're pregnant, the baby pushes up diaphragm but weighs down pelvic floor. So we just want to start retraining it, make sure that our pelvic floor, our core is working accordingly. Okay. So what it looks like is having a hand on your belly and a hand on your chest. And then when you inhale, I don't want your chest to move at all. I want your belly to rise. Okay, so go ahead and do a big inhale. Good. And as you see, she's had practice at this. Not everyone is this good at it. Okay, so what I want you to imagine when you're inhaling is that your belly is like a balloon. That belly is rising, ribs are expanding. Your pelvic floor is actually moving down, relaxing, and lengthening. And then when you exhale, your pelvic floor actually moves up and does a little bit of a contraction. This is super important to be able to do because it will be the foundation for us for building on when we start moving to those higher level activities. So inhaling is great for when you're sitting on the toilet. It helps those muscles to expand, relax, get out of the way so stool and urine can just evacuate smoothly. Super important for immediately postpartum when that first bowel movement afterwards is a little scary. It's also great for when you go back to sex. Doing an inhale with insertion helps those muscles get out of the way. So if you're having any type of pain, it can decrease it a little bit. Okay. Other times important to do diaphragm breathing is if you have any moments of anxiety or stress. A lot of times when we're stressed, our muscles begin to tense, our jaw begins to clench, and diaphragm breathing actually takes you out of the fight or flight and puts you in the rest and digest. So other good times to do it. If you hear that baby crying, go ahead and start doing some diaphragm breathing. Okay. And then the exhale is going to be important because I tell people exhale with exertion. So if you're going to be doing a higher level activity, like picking up your baby when you're standing up off the couch, doing an exhale is a great way for your core and pelvic floor to help support you a little bit better in those activities. Okay. The next thing that we want to talk about is how to activate your deep core. So a lot of times people think of strengthening your core as strengthening your six-pack muscle, when in reality, those don't support you very well. What we want to strengthen is your transverse abdominis that attaches at your back, wraps around your whole pelvic girdle, and attaches at the front. And it supports you like a giant weightlifter belt. So super important that we strengthen this transverse abdominis because a lot of times during pregnancy, our body went from standing upright to standing out with our belly forward. It's just the way that our anatomy begins to change as belly grows. But a lot of times after pregnancy, we still stay like this because our body is used to it. It makes a great shelf for baby. This makes a great shelf for baby. But when we stand in these positions, we're actually cutting off our core, cutting off our glutes, and they're not supporting us. This makes it more likely to put strain on our pelvic floor, pressure on our pelvic floor, more prone to back pain. So it's important that we learn how to activate this core so that we can stand with our ribs stacked over our pelvis and are more supported. It's also the foundation for doing higher level core activities because if we can't learn how to activate it, then we can't learn how to use it when we're doing the higher level activities like a plank, so to speak. Okay, so Kimmy, what I'm going to have you do is I'm going to have you bend your knees up for me. Okay, and then I'm going to find your hip bone over here, and then I want you to find your hip bone over here. Okay, and then I'm going to slide in 2 inches. This is one of the best places to feel if your transverse abdominis is activated. If it is, what you're going to feel is that muscle tighten underneath your fingers. Okay, so now what I want you to try to do is draw your belly in, trying to make your back flat on the mat. And doing it with an exhale makes it even better. Very good. So Kimmy's great at this. She's got practice. But a lot of times this is a really hard position for people to actually feel that happening. When you cue someone to draw their belly button in, there can be a confusion of, do I suck up or is it more of a come in? So if you're having trouble feeling that muscle tighten, another position you could try is on your hands and knees. So I'm going to have Kimmy get on her hands and knees for me. Okay. So in this position, gravity pulls down belly. It's just what gravity does. So belly hangs. So now what I want you to try to do is draw belly button up as you exhale. Beautiful. Okay. So now this is nice and tight. Kimmy, where do you feel that at?
My lower.
In your lower core. Good. So a lot of times this is a much easier position for people to feel it. All right, you can go ahead and rest for me. So how we start reconnecting that core after delivery is doing that exhale, drawing it in, and then just having people hold for about 10 seconds at a time and then rest. People don't have to be walking around clenching their core all day long, but we do want to start sending that brain-body connection of our brain telling our core, hey, you have a job, time to turn on and start doing that job. Okay. Other times to do it is when you're standing holding your baby. Think of drawing in those abdominals. Or if you're at the kitchen sink washing dishes, cooking, think of just drawing it in and holding. Okay, and then rest. Okay, so hold the TA activation for 10 seconds, and then do the diaphragm breathing for at least 5 minutes. Okay. The last thing I want to go over with you guys is what we look for testing to make sure someone has the adequate strength and stability to actually return to running. So being 12 weeks postpartum is a big one. Are you able to walk for 30 minutes without any urinary leakage, pain, feelings of pelvic pressure or heaviness? The next one is being able to do a single leg balance for 10 seconds. So I'm going to have Kimmy show you these as I explain to you what they all are. So the first one is pretty straightforward. I'm going to back this up so we have a full, yeah. All right, full view. So the first one is just being able to stand and balance on one leg for 10 seconds. All right. Okay, so you have to be able to do that on both legs. And like I said, running is a combination of stability, balance, and strength and coordination. So that's checking off balance. The next one that we want people to be able to do is a single leg squat. And you have to be able to do it 10 times on each side. So Kimmy's standing and she's going to try to do a mini squat. Important things you want to watch for is the knee. And you want to make sure that the knee is staying stacked over the foot and not coming inwards. So go ahead and do it where your knee comes in. That is not what you want. If your knee's coming in, that is going to make it so you're more predisposed to get knee pain when you're running. Every step you take, the knee collapses inwards, and that is going to become very uncomfortable very quick. Ways that you can begin to practice this is finding a chair, a couch, backing up to it, and practicing just standing up from there, and then coming back down, and then coming up. The higher the surface, the easier it is. The lower surface, the more challenging. So finding whatever height is more ideal for you. Okay, the next one is being able to jog in one spot for 1 minute. Yes, and the things that you're looking out for this minute that would say that you're unsuccessful with this at the time is if you have any urinary leakage, any pain, feelings of pelvic pressure, feeling like anything is going to fall out. Those would be things and signs to you that you're not quite ready for this. Also signs that you may need to go to a pelvic floor therapist, get a little bit more education on exercises that can get you to this point. All right, the next one is forward bounds. So Kimmy's going to demonstrate for us what a forward bound is. Good. So with the forward bound, this is trying to introduce impact to your pelvic floor, as well as making sure those muscles have enough stability to actually catch you when the impact comes. So running is, the difference between running and walking is that you only have one foot on the ground at a time when you're running. Walking, there's always a very short term turnover with your feet changing. So that is making sure that your pelvic floor can handle the impact. The next one is doing hop in one place for 10 times on each leg. So you're just jumping, making sure you can do 10. And this is practicing endurance of the pelvic floor, endurance and impact combined. Okay. The next one is going to be a single leg running man. And I actually love the single leg running man as an exercise for people to practice balance. So you're on one leg and then you bring opposite arm to opposite leg as if you're running. So the reciprocal pattern of running is your opposite arm comes up with your opposite leg. This requires good stability of not only all of your leg muscles, but also your core and bringing your upper body into it. If we don't have good core stability and rotation, this can be pretty difficult. Okay, so we have to be able to do 10 of those in a row on each side. All right, and the next one are some strengthening ones that we want to make sure that they can do. You have to be able to do all of these exercises for 20 repetitions in a row. The first one is a single leg calf raise, a pretty well known. Okay, our calves are pivotal in the launching off of a foot whenever we're taking a step. And a lot of people, when they go back to running postpartum, will get cramps in their calves. So we want to make sure they're properly strengthened. The next one is going to be a single leg bridge. So laying on here, we have one leg and then we're coming up. Okay, what I want you to watch is how high Kimmy is coming up. She is at a good height. Coming up higher does not necessarily mean more bang for your buck. So a lot of people think the higher you come up, the better the bridge, when in reality, if you go too high, so Kimmy, go ahead and overextend for me. In that position, you're actually cutting off your glutes and putting strain on your low back. So you don't have to go too far up to get good activation there. Okay, and again, working on that single leg strength. The next one is side lying hip abduction. So with Kimmy on her side, abduction is when you bring your leg away from your body. So AB is adduct, ADD is adduct. So Kimmy's on her side and then she is just lifting this leg up. The bottom leg is bent for stability. You want to make sure that you're not rolled too far back. If you're rolled too far back, you're going to feel it more in the front of your leg and your inner thigh. Where I want you to feel it is right here on the side. Okay, that's where the money's at. You can even put your finger back there, and as you lift, feel if that muscle is tightening. Okay, and you have to be able to do this 20 times. Having good glute med strength is what keeps your leg nice and straight when it hits the ground and not coming in. Okay. All right, and then the last one is the single leg sit to stand. Okay, so she did the squats, but you have to be able to actually move from the sitting to standing position 20 times in a row on each leg, which, believe it or not, this is much more difficult than most people think it is. Okay. All right. So that is all the things, you know now why we want to strengthen, that it's best to wait 12 weeks postpartum to return to running. You have a good idea of where to start if you're in that 0 to 1 week. And then the different things that we're looking for to make sure that you're able to do them accordingly so you can get back there safely. So for Sullivan's, I'm actually in the process of creating a return to running postpartum program that is hopefully going to be available around February. And it's going to be a program that walks you from week 0 to week 12 to week 16 that has exercises that you should do weekly. And it will have the bare minimum exercises that just have 3 to 5 for those people who are just trying to get it in and they'll feel like they only have 15 minutes to set aside. And then there's also going to be extra exercises that are safe for each one of those weeks. But for the people who are more eager to get back to exercise, who are maybe used to making time for the 45-hour minute in their day, and are looking for exercises to do safely that will help them get back to their goal of running as soon as possible. So something to look out for. If you have any questions at all about anything we talked about, you can email me at, it's jenny@sullivanphysicaltherapy.com, JENNY. But that is all I have for you guys today. Thanks for watching.